Welcome back to Motors and Medicine. On today's episode, I'm going to be discussing the use of low-dose naltrexone for the purposes of bringing down inflammation if you happen to have a chronic inflammatory condition. So first off, a little background on naltrexone. Naltrexone or naloxone are drugs that are traditionally used for the application of it's like an antidote for overdosing in opiates. So an opiate is something like morphine, oxycodone, that kind of thing. So, or heroin. So if traditionally, if a patient had overdosed on any one of those types of opiate type drugs, whether it was in a clinic, hospital, whatever it was, nowadays naloxone and naltrexone are carried by everybody, from EMS to firefighters to police. They even have them in certain schools. Basically, what happens here is if you have used an opiate for pain control and either taken too much or had a reaction to it to where it caused severe central nervous system depression or respiratory depression and you start to overdose, naltrexone is the antidote. It's what you take to reverse the symptoms of a narcotic or an opiate-based drug, I should say. And it will prevent you from death or from sustaining significant or severe impairment from overdose side effects. Now, traditionally, in the past, when naltrexone or naloxone was used, it was in that range of like 50 to 100 milligrams. And that was a very effective dose for treating opiate overdose. However, in very recent times, probably the last 2 to 3 years, there's been a lot of emerging research on the use of low-dose naltrexone, which is far lower in dose, down at a dose of about roughly 4.5 milligrams instead of 50 to 100. So at a dose of 4.5 milligrams, naltrexone or low-dose naltrexone has been purported to really reduce inflammatory symptoms in chronic inflammatory conditions. Now, these conditions can be degenerative in nature, but they can also be autoimmune mediated inflammatory conditions. So on the degenerative side, you can have people who suffer from, say, a rheumatoid arthritis, which is autoimmune, but is also degenerative, or just osteoarthritis, or any other type of inflammatory condition in the body where you just chronically have inflammation. A lot of that inflammation can be induced by conditions. Some of that inflammation is induced by dietary intake, things like that. But for the most part, it's going to be a medical condition that causes this chronic inflammation. Now, what the studies as of more recently have indicated is that if you use low-dose naltrexone, you can use it as a replacement or as an augmentative type treatment to chronic use of either prednisone, steroids, or even biologicals. And biologicals, for example, would be like a methotrexate or adalimumab, something like that reduces your immune system's ability to fight infection. But because a lot of these chronic inflammatory conditions are immune system mediated, it basically just suppresses your immune system and stops your immune system from attacking your body. Now, one of the side effects of having those types of inflammatory conditions is just having extremely high levels of inflammatory markers. So your SED rate, your CRP, and then just the inflammation that you feel physically, it's just very painful. You have pain in your muscles and your joints, and then it's just very uncomfortable, especially if you have pain that's visceral from, say, like if you have a chronic inflammatory condition like Sjogren's disease or lupus, fibromyalgia, you're going to feel pain and inflammation everywhere. And it's just not a comfortable way to live. So what the studies have shown recently is that they've been testing the effects of low-dose naltrexone. It was discovered in some of these early studies that naltrexone, when it was being used for its intended purposes, they also started to see the effect of a decrease in your inflammatory markers, CRP and SED rate. And when that happened, they started to think it's potential that this one of the side effects of this medication could be to reduce inflammation, overall inflammation from a number of conditions. So they started doing some trials and they whittled the dose down to about 4.5 milligrams. Now that dose is a typical dose that's used for inflammatory conditions, but it can be less than that, it can be more than that, depending on the patient and depending on a lot of trial and error right now. But 4.5 tends to be the standard low-dose naltrexone dose. And at this point, what the studies have been showing is that, number one, it is bringing down not only the inflammatory markers, the SED rate, CRP, but just overall chronic inflammation associated with any of these conditions is being reduced significantly on low-dose naltrexone. And it's also mitigating the use of chronic biologicals, prednisone, and other such type medications. Now, in many of these studies, they're focusing on things like fibromyalgia, Sjogren's disease, other types of autoimmune skin and soft tissue diseases that affect the joints. They haven't particularly focused too much, at least the studies have not given you results right now on diseases like lupus, but they are working on those cases right now. And from what the preliminary studies are showing, that even cases of severe lupus or even severe MS, any type of inflammatory condition in the body, low-dose naltrexone is having a really good effect. Now, there have been a lot of different drugs that scientists have tried to use for the purposes of bringing down inflammation in a lot of these chronic conditions. And a lot of these drugs are primarily biologicals. The only problem with biologicals, although they are effective, they are inhibiting your body's ability to fight infection because they're suppressing your immune system from attacking the body. And when you do that, you reduce your body's ability to fight off any type of infection, whether that be a cold, any other type of viruses, bacteria, whatever. And so the great thing about low-dose naltrexone is that in the studies thus far, it is showing virtually no side effects at all at that dose, no side effects. And so you can use this medication, like I said, as a primary or as a secondary supplement medication if you suffer from one of these chronic conditions like fibromyalgia, Sjogren's, lupus, any of these chronic conditions, rheumatoid arthritis, you name it. You can use low-dose naltrexone, and after at least a few months of being on this medication, you should see a potentially decreased marker for your SED rate and C-reactive protein and other inflammatory markers. And then just physically, you may feel just less inflammation, less pain. And it may get to the point where while you're on this, you might be able to transition partially off your biologics or at least partially off your inflammatory drugs like prednisone. And all those drugs have certain side effects. And so when you suffer from one of these chronic inflammatory conditions, it's already a task and a chore to deal with the condition alone. And the drugs themselves to treat it always have unpleasant side effects. But if you are willing to try the low-dose naltrexone and you start to feel better on the drug and you can wean off part of your prednisone or part of your biologicals or part of both, then your body's just going to feel better overall. You're going to have more energy, less fatigue, and you're going to have less risk of developing infections because your body's immune system is more robust. So that is primarily what I wanted to focus on now with this particular video, was just the advent of using low-dose naltrexone in chronic inflammatory conditions, whether they be autoimmune mediated, degenerative, whatever the case. Some people who just have generalized aches and pains from just old age are actually seeing benefit from using low-dose naltrexone as well. And since there have not been any significant side effects noted, we're really pleased with the preliminary results in the studies. I'm pleased on what I've been reading about in all of these studies thus far, and it just seems like there's a lot of promise with this particular drug. So if any of you out there are struggling with chronic inflammatory conditions, whether it be Sjogren's or lupus or fibromyalgia or inflammatory bowel disease like ulcerative colitis or Crohn's disease, any one of those diseases, they are all responding really well to using low-dose naltrexone. Now, where do you get low-dose naltrexone? This particular drug has not yet been formulated by the FDA to be used as a sole purpose for inflammation. Like I said, it's primarily been used as an opiate overdose antidote. However, you can get the drug compounded if you go to a compounding pharmacy. There's a lot of compounding pharmacies throughout, and they are compounding low-dose naltrexone in capsule form, and people are, like I said, using it for any of these chronic inflammatory mediated conditions. So again, if you happen to have any of these conditions and you're interested in trying it, I think it may benefit you, and you might be able to get to the point where you're not relying on such high doses of your biological or prednisone or both. So hopefully this information was beneficial to you. Again, I appreciate everybody's support. Please give this video a thumbs up if you appreciate the information. Subscribe if you haven't, it'll help the channel grow. And on the next video, I'm going to jump back into working on the Bronco. We're going to get some things done on that, and we'll see how things go from there. But I've got a few exciting videos coming up. Hopefully I can get them done. I've just been a very busy person with work and with family. So again, until next time, this is Motors and Medicine signing off. You guys have a great day. Thanks.